Dr. Ihor Zastavnyi is a family physician in Lviv, at home. Number one, welcome, Dr. Zastavnyi. How are
Hello,
you?
hi.
How are you?
Hi. Like at war. Yeah.
You're at war. You're at war. Yeah. And where are you right now?
Right now I'm in my home, and my wife is taking care of our patients. She is at our outpatient clinic. So we are always doing something. In the night we are hiding in bomb shelters. In the day we are taking care of patients and trying to get the medical supplies for our people at the front lines.
So you're a doctor, your wife is a doctor, and you are working round the clock to help people there. I'm interested to know about the shelters because we tried earlier this week to connect with you on a couple of occasions and we couldn't find you. You'd gone dark for hours at a time. What was happening?
So we are having air alarms from 1 till like 3-4 times a day. When you were trying to get in contact with me, me and my wife and our neighbors were in the bomb shelter for 5.5 hours. So that's why you couldn't get in touch with me. So it's like, I'm so sorry to say that, but it became usual for all of the Ukrainians. When you hear air alarm, you hide. When you don't hear air alarm, you do something which is needed to defend our country.
And you were telling me just before we began to speak on the air, you've already been in the bomb shelter already today. As you say, it's becoming a regular occurrence. A family physician's practice doesn't normally include wartime injuries. Who are you seeing? What are you doing now?
At this point in Lviv, at the GP practices, we don't see war injuries, thanks God. But I know from my colleagues, for instance, we had a bombardment before yesterday on Sunday, 40 kilometers from here. So they've had to provide the first aid, first help for the wounded people in the hospitals. So some of us see the wounded people. I know then that in Mariupol, my friends, colleagues, GPs, unfortunately, we lost them. I mean, we couldn't get in contact with them for like 1.5 weeks. But I know that they've had to provide this kind of help. They've had to do the deliveries, the wounds, and so on. So we are training in tactical medicine right now, the family physicians, all of the physicians, because we, unfortunately, in some time we have to deal with it. And we are doing our best to become better in war medicine each day.
So thankfully, to this point, you have not seen the worst of it. But you're preparing, is that what you're saying? You're preparing that it could get far worse for you in Lviv.
Yes, of course, we are all prepared. We are not safe totally safe in any place in Ukraine. Because until Sunday, we thought that they wouldn't get us here, with the missiles. But on Sunday, we had a bombardment 30 or 40 kilometers from here. And we understood that you cannot feel safe anywhere, and you must be prepared everywhere.
Even in hospitals, as you look after those who've been injured, those who are sick, those who are close to death in some of these situations, the WHO, as you maybe know, it keeps track of this number, and it's just astounding. At least 26 hospitals or health facilities have been hit by bombardments. I mean, what do you think when you see that, when you see the scenes like the Mariupol Children's and Maternity Hospital being bombarded? What do you feel for your personal safety?
I must say that we all think that Russian troops and Vladimir Putin are terrorists, because you cannot bombard the hospitals anyways. I mean, even during the worst wars, you cannot bombard kindergartens, schools, hospitals, and so on. And they do. And this is terrorism. It's war and it's terrorism. They are terrorists. That's everything I think of, and they must be in court for this, and they must pay for this, because huge amount of people are dying each day, especially in Mariupol. Situation in Mariupol, Kharkiv, and so on is like terrifying. And when you read the news about Mariupol, it's I don't know what to say, because they are killing pregnant women, they are killing children, they are killing doctors, they are killing everyone, because they cannot fight in equal with our armed forces, because our armed forces are really good at this point. They are giving a good hit to the Russians. They are afraid. The Russians are afraid to give a fight to our armed forces, and they are bombarding the civilians. And that's terrorism. That's terrorism. And these people are liars, and they are thieves, and they are. I couldn't even find the right words for them.
Well, it's hard to find the right words when you look at the images. You know, we're far away in Canada, but when you see the scale of the attacks on your country, it's overwhelming to look at, let alone to be in it and to have it coming ever closer to you. I'm thinking of doctors who are trained to help and to sort of put emotion aside, just to go to the duty, to the job, and look after somebody. Are you able to do that? Was that a? Are you okay? I don't know if there was a sound outside.
You're I'm okay.
You're okay.
Yeah, everything.
Okay.
Yeah.
Are you able to do that, though, in the midst of this is not anything that you trained for?
We are. You couldn't be totally trained to give the fight, to be at war, you know. But we all are doctors, and we are safe here, right? I mean, for now, we are quite safe. Okay. But I'm always keeping in touch with different doctors throughout Ukraine, the ones that are at the front line and the ones that are giving help to the people and to the wounded and to the soldiers and so on. And we are trying to share our minds and to get something new into our profession. That's our job, and anyways, we must do that. We must help people. We must cure the wounded.
You have a connection to Canada. You got some training from Medical Mercy Canada, I know. So as you speak to Canadians, we're talking a lot about needs for supplies. We're talking about Canadians helping in any way they can. What would you say on the medical front in terms of what help you need from Canada?
Yeah, I've had the training in Canada, in Alberta, in Banff, a few years ago, in CUF, Canadian Ukrainian Foundation. What do we need? Actually, most of all, we need hemostatic agents. I mean, like tourniquets for our soldiers and other stuff. I suppose Canadian doctors are quite familiar with these kind of things. Also, we need some supplies like medications. Some medications are like insulin. We have a not so good situation with insulin. We are trying to provide certain amount of insulin from Poland, and we have a certain amount of insulin here. We have problems with L-thyroxine. It's one of the medicaments. So while the Polish border is opened, I suppose we will be okay. I mean, because we get a lot of help from this border.
Okay.
But if something happens to the border, I suppose the situation would get worse.
We'll keep in touch with you, Dr. Zastavnyi. Thank you very much. You know, we've already been showing pictures of great big Canadian jets filled with medical supplies that people have funded and donated, and they're on their way to Poland and hopefully to doctors like you. And I dare say there will be more from Canada as we follow very closely. Thank you very much for the time, and we wish you very well.